Kia ora koutou. I just want to thank everybody for joining us tonight for our live stream where we can have some really good discussion about our cancer action plan that we've just released. My name's Dawn Wilson and I'm manager of cancer services here at the Ministry of Health in Wellington. I'm joined with great pleasure by Professor Diana Sarfati, who is our new National Director of Cancer Control New Zealand. So welcome, Diana.
Hello.
We're pleased to be able to engage with you all, and we look forward to the questions that you're going to put up for us to be able to answer. We're all touched by cancer, every single one of us. It drives who we are and motivates. It's certainly motivated me in my life to kind of do what I'm doing. And I'm really keen to make sure that what we do at this level is done well and it's done right, and it gives impact to the people who really need it. So that's primarily why I'm here. Diana, do you want to just kind of tell us a little bit about yourself and that would be great.
So I'm a medical doctor and a cancer researcher, and I've spent much of my life looking at why some groups in New Zealand are more likely to develop cancer, why some groups are more likely to die from cancer, but most importantly, what we can do about that. So I've worked alongside patients, their carers, doctors, nurses, Māori and Pacific health leaders, communities, and they've all enriched and informed that work considerably. And I've also sat on a number of cancer-related advisory committees, both in New Zealand and internationally in a variety of capacities. But I'm really thrilled to take on this new role. It presents a unique opportunity to really start addressing the big challenges we have in cancer care and control in New Zealand.
That's great, and it's great having you here with me. I also want to just introduce our sign language interpreter, Jen Gilbert. Thank you for being here, and it's also great to have you doing this for us to make sure we can reach as many people as possible. Tonight, we're going to firstly provide you with a high-level overview of the Cancer Action Plan. This will be followed by opportunity for you to put up questions that we will endeavour to address for you. Questions can be asked through the live stream chat room on, if you're logged in, you should be able to see that. Or you can send an email to the email address on the live stream webpage and we'll also be able to pick that up. We won't be able to answer questions on specific patient or clinical situations tonight, but we're happy for you to send those via other mechanisms if you want to do that. It's more generally about the plan. And remember, you can still provide us feedback on the plan right up until the 13th of October. We'll talk more about how you go about doing that towards the end. So I'm just going to go talk to Diana and let Diana share with us some key facts about cancer and again, why we're really so committed to doing this work.
So as Dawn said, of course, just about everybody is touched by cancer in some way. Cancer is the leading cause of death in New Zealand. Each year, around about 23,000 people are diagnosed with cancer. That's 66 people every day, and around 10,000 people die from cancer. Our population is ageing and growing, and that means that we are expecting to see about double the number of cancer cases over the next 2 decades in New Zealand. And on top of this, New Zealand doesn't affect the population equally. So, for example, Māori are 20% more likely to be diagnosed with cancer and about twice as likely to die from it. And in addition, there are other groups who tend to do worse than other New Zealanders. So, for example, Pacific people, people with disabilities, people with mental illness. Access to some cancer treatments differs across the country, and that needs to be addressed. So there's a lot that we can do to address inequities and to improve cancer outcomes in general. Cancer is also unique in some other ways. Managing cancer well requires the whole health system to be involved, from primary care, screening and prevention services, through diagnostic services like X-ray and pathology, other hospital services like medical oncology, radiotherapy, as well as supportive care and palliative care. The costs and complexity of cancer care and pace of change present particular challenges to our health systems and services. So for all these reasons, we need to take an approach to cancer that is planned and coordinated with clear leadership. So the cancer plan is a turning point in our approach to cancer and cancer control. It reflects the elements that are important to me, and I suspect to many other New Zealanders. First, nobody wants to be diagnosed with cancer, so prevention is key. We want to take the opportunity to make sure that New Zealanders are born, play, live and work in environments that support good health. But if I did develop cancer, I would want it to be diagnosed promptly and to have fair access to excellent care. I'd want the care to be full of humanity, dignity, respect and compassion. And I'd want the quality of my life to be as good as possible through treatment and beyond. So we already have an excellent health system in New Zealand with fantastic health professionals providing really brilliant care. But this cancer plan provides us a roadmap to do even better. So it will strengthen our capacity to prevent cancer, identify where investment in cancer care is most needed, and make sure all New Zealanders have access to world-class cancer care when they need it, regardless of who they are or where they live. So Dawn, I'll hand back to you now to outline a little bit more about the detail of the plan.
At the start of September, the Prime Minister and the Minister of Health launched the Cancer Action Plan, and as part of that release, they made some important announcements. This included the establishment of a National Cancer Control Agency that would ensure and drive all of the things that you've talked about, Diana, that national consistency, quality of care, ensuring it's equitable access for all New Zealanders. So that's really important. We also obviously appointed Professor Diana Sarfati as the National Director of Cancer Control, and again, it's a privilege having her here. The Cancer Action Plan, it's a comprehensive 10-year plan. It covers the full spectrum from prevention right through to palliative care, living well with cancer, and obviously, in that period after treatment. It's guided by 3 overarching principles. It's about making decisions because it's, using knowledge and information to help lead. And it's about, and I've lost it, it's outcome focused. So it's about ensuring that we get good outcomes for New Zealanders no matter where they are on that pathway. New Zealanders have a system of delivering consistent and modern care, and they have equitable cancer outcomes. New Zealanders have fewer cancers and have better survival. So that's really the drivers behind the Cancer Action Plan. So we'll talk a little bit about some of the outcomes and some of the goals that we have in the plan.
Yeah, so as Dawn was saying, we have these 3 overarching principles of the plan being equity focused, information rich, and outcome knowledge driven and outcome focused. So those are our sort of overarching principles, but there are 4 key outcomes in the plan. The first one focuses on New Zealanders having a system that delivers consistent and modern cancer care. And what this is really about is about good strategic leadership, planned sustainable workforce, excellent data and information to inform us about priorities, as well as research support for cancer. So the establishment of the Cancer Control Agency is a really important element of that. It will be the agency that provides a strong national leadership, and it's part of achieving that first goal. So that work is already underway, and more information will be released about the agency over the next couple of months. So we are seeking your thoughts on the health workforce and what we might need in that space going forward, the data and information we need to identify where we should be putting our investments and making sure we're doing a good job at improving outcomes, and also the types of things around research and innovation that will help prioritise investment in emerging medicines, clinical practices and technology. So that's the first key outcome or key goal of the plan.
The second goal of the plan is to ensure all New Zealanders experience equitable cancer outcomes, and they currently don't. We know that. We have good data and information that tells us that. We want to ensure that equity recognises that different people with different levels of advantage there are different levels of advantage, and they require different approaches and resources to drive that care. So how we invest going forward is going to be really important. The goal specifically focuses our attention to deliver for all New Zealanders the best cancer care, regardless of where they live or who they are. We know that We know that if you live in a rural environment, that's going to impact on your ability to have care. So that's pretty important. It's critical that we ensure we achieve equitable cancer outcomes for all New Zealanders. The Cancer Control Agency will develop service models that better support Māori and Pacific peoples to improve their outcomes. The new agency will partner with different population groups and support our workforce to carry out culturally responsive care with a view to enable an equitable chance of success. Essential to this is increasing the number of Māori and Pacific people in the cancer health workforce. We're really committed to working on that, as well as developing cultural safety across the wider workforce. We're seeking your thoughts on a number of things: the development and implementation of Māori frameworks to deliver the cancer plan, and addressing racism and discrimination that you kind of talked a little bit about when you talked about when someone's in the system, they get, offered quite a different pathway sometimes. So I think that's really important. How we can design a system to deliver more equitable outcomes is really key.
So the third key outcome area in the plan relates to prevention, cancer prevention. So cancer prevention is likely to be the place where we can have the biggest impact on cancer outcomes and also reducing inequality. So there's a number of specific areas that we're looking at in relation to that. But in general, what we want is to create an environment in New Zealand that enables New Zealanders to thrive in a healthy way, to support their health and to reduce their risk of cancer. So the specific elements, first of all, relate to smoke-free. So the Ministry of Health is working on a smoke-free 2025 plan, and that work will continue, as will the work to develop healthier food environments, particularly in schools. We wanted to look at mechanisms to reduce the harm from alcohol, which includes cancer-related harm. Skin cancers are, of course, very common in New Zealand, both melanoma and non-melanoma skin cancers. So strengthening prevention campaigns there is important. And finally, we want to investigate strategies to address cancers that are caused by chronic infections. So this includes improving the detection and management of hepatitis B and hepatitis C, and also looking at strategies to address a particular infection called H. pylori, which can be associated with stomach cancer. We're seeking your input and thoughts on all of those strategies within the plan.
And the fourth outcome is New Zealanders have better cancer survival. So how are we going to do this? And there's already a lot of work underway in New Zealand, particularly here at the Ministry, but surviving many cancers can rely on being diagnosed early. So getting people in the door at an early point in time will impact hugely on their survival. And accessing a system that is well coordinated. We know at the moment that it's a little bit fragmented. We're not working well with primary care. How do we drive those quality improvements in that space? And it's focused on outcomes, which is information rich. So we're really driving that knowledge driven principle that we've put in the plan. And it should also respond to timely and effective care in an appropriate way. Just want to run through with you some of the key things that we're already working on. So we've already got a program underway where we're developing quality performance indicators across our various tumour streams. And last year we had the privilege of working with some quite key New Zealand clinicians to drive quality improvement in bowel cancer and pull together a bunch of indicators that would support quality improvement by DHBs and also demonstrate to us where there is national inconsistencies across various DHBs and how we can work effectively as a sector to drive the improvements that need to be made. We want to invest in workforce technology and treatment capacity for radiation oncology, and we want to nationally agree the scope and distribution of specialist service and cancer surgical services across the country. So where should they be? Where are we going to get the best outcomes for people? And we want to develop options for an early access scheme in new medicines. So we want to look at how that might be able to happen here in the New Zealand climate. We want to ensure New Zealanders receive family whānau-centred care. So what does that really mean and what does that look like? So we need to do some work with some of our Māori leaders to really drive that. to ensure that they do get diagnosed early, and that does happen. And we want a cultural shift in the way we deliver health services. What are the new models of care that we can drive? And we've been talking about this kind of thing for many years, but we actually want to really put some weight around that and make that happen. And I believe that part of the work we're doing with Cancer Agency and having national leadership will really help make that happen. We also want to raise awareness of cancer among families and whānaus. We want people to be able to identify and feel like they can go and ask for help wherever that might be, whether it's an iwi provider or someone in their community, and actually talk about the fact this is happening, because we can't delay this stuff. We're wanting your thoughts on how we can increase early detection of cancers, how we can improve our national screening programs, ensure equitable participation for priority populations. How do we get our unevenly distributed populations to come in for breast screening? So, for Māori women, that's really important. What do we need to do to actually make that happen and make that much more, a lot easier for people to access? And we want people to obviously have high quality treatment, and that involves looking at new technologies, all sorts of, there's a lot of work inside that. And we also want to ensure that for those who do go on and require palliative and end-of-life care, that they have the best palliative and end-of-life care that they can get, and that they're well supported during that time. We're ready now to begin to answer your questions. So our first question has come from Sandra, and her question is, can you explain what a single network might look like? And what we can tell you is that the regional cancer networks were formed in 2005. They were there to support district health boards to deliver improved local outcomes for patients. They've done a really good job of that so far. But what we want to do is we want to have a national consistent approach to how we drive quality improvement, how we deliver care, and we believe that having one national network will help inform that. Is there anything you want to kind of add to that?
Yeah, no, I agree. So the regional networks have indeed done an excellent job. But we also need a national view of how we manage care so that we don't have regional variations in both care and outcomes. So it's building on the strengths of the regional networks, but creating some consistency in planning around what we do nationally as well.
Absolutely.
So the second question we have, cervical screening using HPV test will mean most women won't have to endure invasive speculum exams, and with HPV vaccination, it means we can pretty much eliminate cervical cancer in a few decades. Why are we not already doing that? Well, thank you for that question. Cervical screening, as you know, is available for all women aged 20 to 70 in New Zealand. And at the moment, the ministry and the minister is considering replacing the current screening program, the cytology screening program, with HPV testing. And one of the advantages of HPV testing is also allowing self-testing. So these things are being considered and maybe being rolled out in 2019, 2020.
Okay.
Just getting the next question up so we can see it. Here we go. Do you think that your plan to address the no, just let me see if I can work this out. Do you think your plan to address the Pharmac will clarify for New Zealanders how Pharmac work for New Zealanders, and going forward they are more visual in what drugs they will be funding? Right, I'm going to assume that this question is asking about whether or not this work will allow us to understand more about Pharmac's processes. As you know, Pharmac is an independent agency, and we have a lot of respect for the work that they do. But I have very early on created a close relationship with Pharmac, and very keen to see work that they're progressing on improving the clarity of their processes, the transparency of their processes, and as well as also the speed of their decisions. So these things are being worked on currently with Pharmac, and I'm also wanting to talk to them about what else we could do to help patients with cancer currently. So this is an ongoing dialogue that I'll be having with Pharmac now and into the future.
Okay, Ian. This is a question from Ian. The cancer continuum covers the whole pathway from prevention through to screening and early detection and diagnosis, treatment, living well, and after cancer, palliative care and end-of-life care.
So I think Ian was asking what the cancer continuum was, and you've answered the question.
I've answered the question. So the
question
is that we're looking at it as a whole pathway, not just in pieces, but as a whole pathway and how that works effectively together.
So we're just waiting for the next question. There's a slight delay before the questions come up on our screen.
Yeah.
So we have got a question about what does the ministry mean by equity? So some groups, as we've already talked about, have worse outcomes than other groups, and those differences are unfair. So when we think about equity, it's about making sure we provide the resources and systems that allow everybody to have similar outcomes. So we're interested in equity in outcomes, which means that there may be differences in the processes we use to get there. There may be more investment in some areas to allow some groups to have the same outcomes as everybody else. So we're really focused on equity and outcomes. So hopefully that answers that question.
Excellent. So we have another question from Sandra. Can you tell us what extra funding is going to be made now for this plan? The Cancer Board will prioritise actions in the plan. So that's the first thing that needs to be done before we actually make any investment. Additional funding already approved for Pharmac and Linux has been put in place and is there, which is great. And it's great. It's great that we can invest in these Linux and actually improve outcomes for patients who need radiation treatment. Further funding will be identified through the standard government process, but we've got a bit of work to do first before we get to that point.
But there will be a budget bid going up this year to a cancer-focused budget bid to ensure that we have got some resources to work in this space. The exact amount of that budget bid and the exact content of that has yet to be determined. That's the work that needs to be done over the next few months.
Yeah, that's right. The next question that's come up is, how will the Cancer Agency improve outcomes?
I'm going to jump in here.
You go for it.
Yes. So the Cancer Agency provides national leadership and sort of thinking about cancer as a whole package, because what we've tended to do in New Zealand is had quite a regional approach to dealing with cancer. That has some strengths, but it means that there is some patchy outcomes. There are some areas where we're not doing so well. There's some things that we're doing which are probably not of world standard. And so what we wanted to do within an agency is to be able to look at what we're doing, improve our processes and improve outcomes for everybody in New Zealand with cancer. And it's that sort of approach, that kind of agency approach or central leadership is very common in countries that are doing well in terms of cancer. So this is really best practice. So we're really excited to be able to launch the agency shortly.
Absolutely. The next question is, when will the Cancer Agency start working? Well, I'd have to say, and you probably want to add to this a little bit, that the Cancer Agency has started working already, that having Diana on board means that we've got quite a focus on our work, the work that we're doing. She's already started working across some of our teams to look at what we're doing and look at what needs to be done and how we can prioritise. But we had agreement that we would have this agency standing up by the 1st of December. So that's kind of where we're going. And we're looking at the moment things like what sort of workforce do we need to help drive that, and what does that look like. So is there anything you want to add to that?
I don't think so. I think, this, we're really trying to hit the ground running.
We are,
And I don't think I've got anything more to add.
Okay.
But we have another question. Why are you promoting vaping when it is not safe? So this is a good question, because obviously vaping is a really big issue. We'd like to be really clear that we're definitely not promoting vaping.
Absolutely.
Vaping can be sometimes useful for people who are addicted to tobacco smoking, and it can be helpful in terms of stopping smoking cessation, and it's almost certainly less harmful than cigarette smoking, right?
Absolutely.
But we absolutely are not wanting people to take up vaping. Would you want to add anything?
I absolutely agree. I mean, vaping is not something we're encouraging people to do. It's there as a tool to help people who actually want to give up cigarette smoking. Their addiction to nicotine is it's really hard to give up. And actually, I've talked to a number of people lately who have used vaping to give up smoking, who've smoked for a very long time. And so from that perspective, it's quite effective. But it's certainly not about encouraging our young New Zealanders to start smoking. And actually the work that's being done, by our tobacco control team, which is to put some legislation in place that will protect our young people from thinking about, the flavours that they might get into. So there's a lot of good stuff happening there. Yep.
So we have a question from Heather. Head and neck cancer is on the increase with HPV being a big driver. What are your plans around this? So thank you for that question. You're absolutely right. On both counts, that head and neck cancer is on the rise and that HPV is a big driver. So obviously HPV vaccination is an important preventive element in terms of head and neck cancer. So this is one of the cancers where chronic infection is an important element of that. In relation specifically to head and neck cancer, there is some work that's just starting in terms of developing some quality indicators, in terms of looking at how people are diagnosed, when they're diagnosed, what treatment they're receiving. And the purpose of that is not in and of itself, but to look at where people might be missing out, where there might be bottlenecks in the process, and what we can improve. So that is ongoing work, and we would expect that to continue.
Absolutely. Okay, there's another question there. So we're down to, will the Cancer Action Plan address the postcode lottery issues and improve outcomes for New Zealanders?
I'm happy to jump in again.
Go for it.
Okay. Again, this is really what the national leadership is all about, is to look at what we're doing. Exactly as I just said for the head and neck cancers, we're wanting to collect information to identify what we're doing well, what we're not doing so well, what regions are not doing so well, support them to bring their levels up to where everybody else is. We're wanting to make sure that people aren't falling through the cracks. So all of that requires a kind of a national approach, and if we do that, we're reducing inequalities between regions and between groups of people, but we're also improving the cancer system for everybody. So it's a win-win sort of situation.
Absolutely. We have another question actually about vaping, so I can probably provide a little bit more context to that. So what is the government doing about all the advertising of vaping? Well, the government is working to put legislation in place, which I talked about before, as quickly as possible to ensure vaping products are accessible to those who need them while protecting our children and our youth, which we're all absolutely committed to. A bill to amend the Smoke-Free Environments Act is expected to come before Parliament by the end of the year. And you can feed back. There will be an opportunity for you to put a submission in, and to that if you don't agree with it. So that work.
Or if you do
agree, because there's plenty of New Zealanders who agree. So that's really important as well. So yeah. So we have another question now.
So what is your plan to consult with the allied health workforce to make sure that you can implement new initiatives? So obviously allied health professionals are a really critical part of cancer control.
Absolutely.
And they've had a really important role in terms of cancer work to date in the ministry, as well as the plan. So for example, a number of allied health professionals work on cancer-related advisory commissions within the ministry.
Yep.
You've met with a number of
That's
groups.
Right. I've had some discussion with a number of allied health professionals, and also at our workshops we held in February when we started this work. There were a number of allied health professionals there, but equally, they're quite welcome to feed back to us, and we're really happy to come out and talk to groups of allied health professionals, because we know that occupational therapists and physiotherapists are all really important to this journey, and part of what we're doing, psychosocial support, all the work that goes on and behind that is really critical to ensure we get good outcomes. It's a team that we're working with, not just one. So we're committed to working with our allied health professionals on this plan.
So how has the workforce been considered in setting up this agency and action plan? Shall I jump in?
Yeah, jump in.
Okay, I'll jump in. So obviously the health workforce is absolutely critical to the success of the Cancer Action Plan and a success in relation to improving cancer outcomes in general. We know that we have some shortages in our healthcare workforce that we need to address. We need to also look at the makeup of our workforce in terms of, for example, Māori and Pacific people in the workforce. So what part of the plan is to do some modelling about what workforce we need going forward. Yes, sorry, lost my word there for a moment. Going forward, and then to start planning how we address the gaps. So we've already started doing some work in relation to that with the radiotherapy workforce, but it's really critical that a strong, sustainable health workforce is one of our absolute critical priorities.
But I think it's also about looking at, new models of care. So
That's
how
right.
do we, for many years we've talked about how we can effectively use our nursing workforce to help drive some of the work that we do. How can, what can we do in the cancer space with nurses, with allied health professionals? How do we bring them in? We know that our senior clinicians in most hospitals are quite stretched, and we want to also work with them to look at how they can sort of hand things over, what parts of work should they be doing as opposed to what a nurse could potentially deliver. And nurses are really effective, efficient, and they're a really important part of our workforce. So we want to look at all of that as we drive through components. We can't do everything at once. So we're looking at radiation treatment, and we've got we're looking at developing a national model and effectively using the entire workforce to ensure that people get good care. So I think there's a lot that can be done in that space.
So, next question. Does the agency go beyond a Ministry of Health purview to other parts that would be on a continuum? And again, that's a really good question.
It is.
The intention is that the agency will sit within the Ministry of Health, but the head of the agency will be reporting directly to the Minister of Health, and the expectation is that that person will be linking within the Ministry of Health, but also beyond. So, for example, Pharmac is not part of the Ministry of Health, but we've already created some strong links there. So our focus is on cancer control, regardless of where the activities sit. So we definitely will be looking beyond what's
and also NGOs. So NGOs
right.
do an amazing job, and we don't often quantify how, if we took them away tomorrow, what the impact of that would be. So they're really important. They look after people when they're really unwell and provide that sort of care. So we want to be able to work really closely with NGOs. So there's a lot happening out there and with those groups too that we need to sort of engage more with. So how will the governance plans ensure better accountability? How will new governance plan to ensure better accountability? The new governance group that is being established to support Diana and her work and as part of the national agency will publicly report against this Cancer Action Plan. So there'll be a high level of accountability to the public for that, and opportunity for them to also provide feedback through various mechanisms. So is there anything you want to add to that? Because accountability is hugely important. Yeah. We can do all this work, but if we don't know that we're making a difference.
It's interesting actually, because the World Health Organization, one of the key things in terms of improving cancer outcomes is that you need to be able to identify a person who's responsible for improving cancer outcomes. So having an agency and having a head of an agency allows us to have that in New Zealand, and we haven't had that before.
No.
So, it's a step forward.
And I don't think Diana would want to be telling people in 2 years' time that we haven't achieved what we said we're going to achieve. So I think we're on a pathway to really making this work.
So we have a question from David Tiffany Leach. Kia ora, David. And he asks, can you outline your initial thinking about the approach to equity for Māori? And this is obviously another really key question. So we will be setting up the board. We're in the process of setting up the board, the advisory board for this work. And our expectation is that we will have half or close to half of that board being made up of Māori, key Māori leaders. And so actually achieving that at a governance level is a really critical part of addressing inequalities in outcomes, cancer outcomes for Māori. When we think about this, we need to be thinking about what we're doing at every step of the pathway. We know that Māori tend to be disadvantaged at every step of the pathway, so we have to have a very holistic view of that, but also that the solutions for Māori are likely to be identified by Māori. So that's why it's so critical to have Māori in those senior governance positions as well as all the way through the system. So it's really just a whole package of activities there. I hope that answers your question.
I'm sure he'll come back if it
I'm
doesn't.
sure he will.
So we have another question there. Will a cancer plan include access to oral rehabilitation and dental care? Whoops, the question's gone. When they've had radiation treatment, there we go. When they've had radiotherapy treatment, it is a difficult area for patients. I really acknowledge that, and I know that the work that will be done around head and neck will begin to look at the impact of on your oral health for. And it is variable around the country, so I think there's a bit of work to be done there, but I think we need to we need to ensure that's considered, because that's pretty hard for people. So yeah, we need to put some thought and thinking in that. We've got a great oral health team here in the Ministry of Health, actually, so I think some discussion and dialogue with them will be really appropriate as we move forward.
So we have another question. Why are Māori less likely than non-Māori to be diagnosed at earlier stages of the disease for several types of cancer? So first of all, just a little bit of background there, that when we look at stage of diagnosis and we compare Māori and non-Māori patients, there's quite a mixed picture. So for some cancers, the stage distribution is very similar. So Māori have similar rates of localized disease or advanced disease, and for other cancers that's not the case, and Māori might be less likely to have localized disease. In terms of why that is the case for those particular cancers, it's likely to be a combination of access to primary care, poorer access to primary care, possibly poorer access to screening, because we know that some of the cancers, for example, breast cancer and bowel cancer, both of which are amenable to screening. So it's looking at the front end, if you like, of the cancer control continuum, looking at what the barriers might be to getting timely diagnosis and then addressing those barriers, particularly for Māori.
I think you've answered that really well. So we have another question there. How will the new cancer agency report on its progress to the public, and how often? I just sort of touched on that really briefly before, but I think that's undefined at the moment, but that there is an absolute commitment to do that. And I think it would be dependent on what it was that we were reporting against. So you wouldn't report every month on progress against the action plan, because some of those actions are quite long term to get the outcomes that we actually need. So there'll be some things that we can publish really quickly, and I think it's things like making available meetings of minutes of various meetings that might be had, so people can sort of see what's going on. But we're absolutely committed to transparency, and so I think I can't answer how often that will happen until we know what it is that we're actually going to report. So that will take some time.
So, and I might add to that we have yet to make a final decision on exactly how that would work. But I would like to see something like a State of the Nation cancer report coming out on a regular basis. Exactly how regular needs to be determined. It depends on what the scope of that report is. But I would like to see a report coming out so that we can see how we're doing in relation to the to diagnosis, treatment, outcomes, and prevention. So hopefully we will get that underway reasonably soon.
Absolutely. I mean, there's a lot we can do. There's a lot. So then we have another question. We're up to Marge asked, are you confident the agency will have the ability to be aware of what is happening at grassroots level in New Zealand? So what's actually happening on the ground?
Yeah.
This is about, again, I think NGOs will have a really good role to play in ensuring that patient voices are heard. We want to look at patient-reported measures, so giving people who are receiving treatment the opportunity to actually feed into a process. So I think that's I think that's going to be really important. So that development is a wee while away. Yeah, and I think going out and talking to people, we're here at the ministry, but we're always happy to hear from the public, and we endeavour to always get back to people who come into us with questions or want to tell their story about their journey. And those things are really important to the work that we do, because that's why we're doing what we're doing, because we need to make some changes. So really happy to hear.
Yeah, and also part of the role of the National Director of Cancer is to be out and engaging with people and groups. And so this would be an ongoing process. There was a question which appeared and then disappeared from someone asking about whether we would be continuing to engage with cancer consumers and cancer and patient advocacy groups. And the answer to that is we will absolutely be continuing to engage. So, for example, there's a group, I'm sure you may be aware, a group called Kango, which is a group of NGOs, patient advocacy groups, and I committed to make sure that I attended their meetings so that we could be talking about what's going on and how things were progressing. So that's one example. So absolutely engagement with patients, their families, professionals is absolutely critical, because if we don't engage with them, we don't really know how we're doing.
Absolutely. Will you seek input from national patient advocacy groups on a regular basis?
I think
we just answered that. Sorry about that. So where are we up to now?
I think
We've got
Ramesh.
Ramesh.
Yep. What steps will you take to ensure New Zealand radiotherapy services are regularly reviewed to optimise timely integration of latest technology? So perhaps you want to.
Well, we're actually doing some work at the moment, and you will have been aware of the announcement of the replacement of the linear accelerators. There's a number of them around the country that need to be replaced. But part of our work is to review technology, but we need to build a plan around that, on how we're going to do that, who's responsible for it. We work really closely with our National Radiation Oncology Working Group, so we're going to get their input into that as well. But I think we're still a wee way from sort of being able to release that kind of work, but we've got someone who's working on that at the moment, because it's really important that we get it right. Yes. So.
Now, let's just see where we're up to with the questions. So the question is, isn't the consultation just a tick box process if you've already made decisions? So what we would say about that is there are some actions in the plan which are already underway. So those actions are underway, but there's a lot of other actions in there which are new, and we're really seeking feedback to find out whether we have got the right actions in there, to prioritise those actions, and also to think about any gaps or anything else that we may have not put in the plan. So this is absolutely not a tick box exercise, and we're actually getting a lot of feedback, which we're really delighted about, and I think that will strengthen the plan.
Absolutely. How is the leadership of the group going to be appointed? So they are going to be appointed.
They're going to be appointed, that's right. So that I assume that refers to the board. So what we're going to start off with is a very small skills-based board that's able to make decisions quickly, because we want to be moving quickly and getting the agency implemented. So that the final decision about the structure of the board currently rests with the Director General, but that's in consultation with me as National Director of Cancer. So we're working on that right now. So there's a question here from Elizabeth, which says, increasing the Māori and Pacific workforce is a long-term game. Where is Health Workforce New Zealand in this plan?
Health Workforce New Zealand have been working with us, and they clearly have a role. I mean, I think the first part of the plan where we talk about a sustainable system, we have Health Workforce in there. We need to really map out what we want, to do in partnership with them. So they're up for working really closely with us. We're already doing a piece of work with Health Workforce New Zealand around the radiation treatments. So looking at future projections of what kind of workforce we'd need, given the growth and the likely growth for service users, we need to make sure we've got that mapped out. But we know we've got a shortage right now as well. So there's a lot of work going on with Health Workforce New Zealand. But radiation treatment is only one example. I think that as we progress over time and start working across various parts of the plan, we'll work really closely with Health Workforce New Zealand. But they're really committed to working with us, and they've got some great resource and skills in there to help. So yeah.
And then from Nina Scott.
Kia ora, Nina.
Kia ora, Nina. What are your thoughts on dropping the bowel screening age for Māori? Right, well, this is a big question. So as people may or may not be aware, we have a bowel screening program which is currently rolling out. I'm sure most people are aware of that. The current screening age is 60 to 74. And what work has shown is having the bowel screening age in that range means that we're missing out on about half the cancers among Māori, because a higher proportion of cancer among Māori is diagnosed earlier. So the recommendation from the sector has been that the age range should be extended for Māori. And I think in general the sense is that the ministry is supportive of that. Yeah, I think that's probably...
Absolutely. But again, we have to look at things like workforce planning and the impact of that. But please, New Zealanders, if you're concerned about your you feel like something's happening, go and talk to your GP. I think, it doesn't matter what age you are. We just want to get people in the door really early. So we have a question from Ian about survivorship. The previous minister established the Cancer Advisory Group that was set up under Annette King. Before the work was arguably completed, what would be done with survivorship, and which might be the most expensive? So survivorship, again, as we talked earlier about our quality improvement work. Part of that work is actually looking at across the whole continuum. So if we took something like lung cancer or bowel cancer, we're looking not just at developing indicators here, but what happens at the start of that pathway? What is it we need to be doing? And then what do we need to do in terms of survivorship? And there's a bit of variability around the country about that, but we've got our National Lung Cancer Working Group in partnership with the Midland Network have been doing a great piece of work on follow-up and surveillance, which is around looking after people after they've had their treatment and what that might look like. And so we're just in the process of working through those. In fact, I was reading through them today to look at getting those published, and they'll provide some guidelines that we want to be driven nationally, to ensure people are followed up in a way that's appropriate for them. So survivorship is really important. And it's an important component of the plan. And many people survive well with cancer, so we want to make sure they stay well.
Great. So we've got a question about the Cancer Agency.
This is a good
Isn't
one.
this just setting up another layer of red tape? What will the agency actually achieve? The answer to the first part of that question is no. Actually, as I was talking about earlier about the World Health Organization is very clear that in order to get optimal cancer outcomes, you need to have centralized planning. So we haven't had that for a while in New Zealand. And what the most recent data suggests is that the rate of improvement in cancer survival in New Zealand is slower than other comparable countries. So we're starting to fall behind. So the agency is focused on improving outcomes. And because we've got a national focus and we are right across the cancer control continuum, we have the best chance of actually having an impact.
Excellent. We've got another question. This is a good one too. Is there a role for developing national centres of cancer care in addition to improving regional centres of excellence? I think you might like to answer that.
I'm happy to answer that. I think the answer to that question is yes, there may well be. And the example of that is the paediatric centres. There's two centres in New Zealand. There used to be more, but work was done to identify that actually having fewer centres would be likely to result in better outcomes for children. And indeed, that proved to be the case.
It's a great example of an excellent piece of work.
So it may be that is also the case for some other cancers, but that's work that we need to do, to look at the cancers for which centralised treatment is likely to result in better outcomes for patients. But of course, all of this always has to be balanced with convenience of local care. So, but there are some cancers where central treatment can really make a difference to outcomes.
Particularly those rarer cancers.
That's right.
Would be really important. Absolutely.
All right. So,
okay, the question is, would you like to read the question this time?
Yes. What are the barriers to entry for the current screening programs, and what population group is not being screened? I'm also happy to address that question.
Go for it.
So in New Zealand, we have, in terms of cancer, we have 3 cancer screening programs: cervical screening, breast screening, and bowel screening. About 70% of women are screened in the appropriate age range are screened for in the bowel and cervical screening programs. Screening uptake is a bit lower for Māori women for both of those screening programs, and so there's still work being done to try and make sure that those screening rates are equivalent. For bowel screening, there is a bigger gap between Māori and Pacific on one hand and non-Māori, non-Pacific on the other. And there's been a lot of work thinking about how we can improve uptake rates of screening and providing screening in a way that's acceptable to all populations. The other group that are less likely to be screened for bowel screening are men. Women tend to be better at doing that than men, so they might need a little bit of encouragement as well. So we're definitely watching to see which groups are more and less likely to be screened, and then addressing the problems when they arise.
Well said. Okay, gosh, I can't believe how quickly time is flying, but we've still got a bit of time to answer some more questions. So the next question we've got is, what's the time frame for the development of the Smoke-Free 2025 action plan? And I can tell you that Minister Salesa has asked officials to prepare advice on what might be in the Smoke-Free action plan, and that a paper is going up to Cabinet this year, and there will be opportunity for public consultation on that plan. So that's pretty exciting. And we've got some more. The question is, what are the other cancers that are being considered for early detection programs similar to the one for lung cancer?
So on the horizon in terms of cancer screening, probably there are 2 programs, in addition to the shift to HPV screening, which is also a shift for us in terms of cancer screening. The other 2, as you've mentioned, is lung cancer screening. So the way that lung cancer screening works, it's not for the entire population. It's for a subset of the population that have been heavy smokers in the past, and again, within a particular age range. It involves a CT scan, so it's quite a major test. So that is being evaluated currently. And the other one that may be being evaluated soon is screening and treating for H. pylori infection. So I mentioned H. pylori earlier on. It's an infection that lives in the lining of the stomach, and it can cause stomach cancer many, many years later in a small proportion of people with that infection. The majority do not go on to get stomach cancer, but that screening program is a bit different because it involves identifying the infection and then treating the infection to prevent the development of stomach cancer later on, rather than screening for stomach cancer per se. So those would probably be the 2 next programs that are sort of being investigated.
And actually, where there aren't screening programs, is part of our tumour stream work. When we're looking at the whole pathway, we're looking at what we can do to support GPs, and we've been working really closely with some GPs and from the Royal College of GPs here in New Zealand to look at what they consider might be needed to help sort of work with general practice. So I think that's, where there's no screening, we are trying to raise awareness, and we will be developing packages around that. So I think that's pretty important as well.
So Ian asks, will all DHB cancer departments be brought under one best practice umbrella?
Well, that's a tricky question to answer, but actually, if you think about the example Diana gave before, which is around child cancer, there is a model there where child cancer is delivered in 2 big centres, but while it's delivered in 2 big centres, they also support the other DHBs to ensure that when children leave and go back. So I think there's some opportunity for that. And radiation treatment, there are 6 publicly funded radiation centres in New Zealand, and about 3 private centres. They are centres of excellence. Radiation treatment is not something you'd want delivered everywhere. There's a small workforce, quite significant expertise required to deliver that. So they are centres of expertise. So we already have some of those kind of models. But again, some of the smaller tumour streams, there may be opportunity to think about how we do that, and we'll do that in consultation with DHBs, the sector, with others to make sure we get that formula right. Absolutely.
So are there currently national centres of expertise, and if so, what are they? Well, yes, there definitely are, and I guess we particularly see this with the less common cancers. So we've already talked about paediatric cancers, where cancer among children, where there are definitely national centres of excellence. There is, for example, a national centre of excellence for neuroendocrine tumours, with a very close network to ensure the quality of their work. And there are other examples, but they are particularly focused on the more uncommon cancers for obvious reasons, really.
Absolutely. So we don't have much longer to go, but we've got time for just a few more questions, I think. So we've answered that question. So the next question we've got: what is the program to address deaths and injuries and ill health arising from work, including cancer? Well, we were really delighted to be working with WorkSafe when we developed this plan, and their commitment to working with us to ensure exposure to certain chemicals or whatever it might be is undertaken. So they've got a program of work that they're going to start really working through, and we'll continue to work really closely with them. So that's really exciting.
Okay, we have a question. What is the evidence that shows that reducing the accessibility of alcohol and the amount of alcohol advertising is effective in reducing cancer? And that's a good and specific question. There is evidence that doing those things reduces the harm from alcohol. I'm not sure about the specific evidence about relating to cancer. It would be something that I would have to go and look up. But in terms of reducing harm from alcohol, those sort of approaches have been shown to work.
As we get evidence, we'll be able to look more closely at the impact of some of that. I think we might be actually running out of time. Look, just to be really, if you've got further feedback, please send your questions to us or send your feedback in via our website, via the Ministry of Health website. There's some surveys, some ability to provide some responses. Is there anything you want to add that might be useful you can think of top of mind? We've got just a few more minutes before we actually wind up.
Well, no, I feel like I might have talked enough, but just to say that I think that we have a really exciting opportunity here in New Zealand. As I said right at the beginning, cancer is uniquely complex. It's the #1 leading cause of death in New Zealand. There are major inequalities in outcomes for cancer, and cancer care is a very big part of our health budget. So it's timely to start thinking about how we do business in relation to cancer and improving cancer for outcomes for New Zealanders. And this is our opportunity to do this. So we're really interested in your views and any ideas that you might have to help and support this work. And I would like to thank you all for coming along to this event as well.
Absolutely. Your questions have been really insightful and really useful to us. So again, just thank you for coming and spending the time listening to us today. I hope it hasn't been too sort of drawn out, but I think we got some really good information from that and some of the questions. If we didn't get to your question, we really apologise for that. But however, we still want to hear from you, as I have already said. There are 2 surveys on our website until the 13th of October. Please go on and complete them, provide your feedback, because that will help inform how we finalise this plan. And by then we'll have a board and we'll be able to take it up to our board and all the feedback as well. So we're going to do a lot of work in that space. We're asking for your experiences. We want to hear your stories, and we want to be able to support you to get the best possible outcome when you're confronted with something that is actually incredibly life-changing. So the first survey asks us to share experiences. The second survey is specific feedback about the Cancer Action Plan. So tell us if you don't like it, but tell us why. We want to hear why and what it is we've done wrong. And as I've already said, the information will be used for the final plan, which we hope to have released in 2020. There's a bit of a process we have to go through, and to get it right, that's going to take a little bit of time. So we just want to thank our wonderful sign interpreter. She's been great. And yeah, thank you. And it's good that we can kind of extend this to all New Zealanders. And to Diana, we know we're going to make it work.
Thank you, Dawn, and thank you all for coming.
Thank you. Excellent.